Have you started noticing subtle, puzzling changes in an elderly loved one? Maybe your mom, who always loved baking pies for family gatherings, now barely touches her kitchen. Or perhaps your dad, once eager for morning walks, seems unusually tired and withdrawn. These could be quiet signals that they're in their final year. I learned this the hard way, caring for my grandmother, whose gentle shifts, like skipping her favorite card games, caught us off guard. Today, I'm sharing 5 critical signs to help you recognize these moments and support your loved one with the love and dignity they deserve. In this heartfelt video, we'll uncover 5 subtle warning signs that may indicate an elderly person is nearing the end of life, grounded in medical insights and real-life experiences. From unexpected weight loss to fading social connections, understanding these signs can empower you to provide compassionate care and make every moment count during this precious time. We're approaching this topic with the utmost sensitivity, keeping it informative and focused on equipping you with the knowledge to care deeply. This isn't about fear or sadness. It's about fostering connection, preparing thoughtfully, and honoring your loved one's journey with grace and understanding. If this speaks to your heart or your caregiving journey, please hit that like button, subscribe for more elder care insights, and share your own stories or questions in the comments below. Your experiences can inspire and comfort others, and we're here to build a supportive community. Let's dive into these 5 signs to help you navigate this chapter with confidence and care.
Sign 1. Significant weight loss or appetite decline. The first subtle sign that an elderly person may be in their final year is significant weight loss or a noticeable decline in appetite. Unexplained weight loss, especially when paired with reduced interest in food, can be an early indicator of declining health. As the body approaches the end of life, its metabolism often slows, reducing the need for calories and naturally decreasing hunger. This can be a normal part of aging in the final year, as the body conserves energy for essential functions. However, appetite loss can also stem from chronic conditions common in seniors, such as cancer, heart failure, or kidney disease, which may suppress hunger or make eating uncomfortable. Additionally, medications, digestive issues, or even psychological factors like grief can play a role. A 2024 study in the Journal of Geriatric Care noted that 60% of seniors in their final year experience unintentional weight loss of 5% or more of their body weight, often tied to these underlying changes. Recognizing this sign early can help families respond with care and seek appropriate support. Many families notice their loved one stops enjoying meals they once loved. For instance, imagine a grandmother who used to savor her Sunday pot roast, filling the house with laughter as she shared stories over dinner. Now, she picks at her plate, saying she's just not hungry or that food doesn't taste the same. Her clothes start to hang loosely, and she's lost noticeable weight in a few months. This shift, while subtle, can be a red flag that her body is slowing down or that an underlying issue needs attention. Tip: if you notice significant weight loss or appetite decline, encourage a visit to a doctor to rule out treatable causes, such as depression, dental problems like ill-fitting dentures, or medication side effects. Blood tests can check for issues like thyroid dysfunction or infections. In the meantime, focus on offering nutrient-dense, easy-to-eat foods. Think smoothies packed with fruit and protein, soft scrambled eggs, or small portions of avocado toast. Make meals a comforting experience with familiar flavors or gentle company, but avoid forcing food, as this can cause distress. If the decline persists, discuss palliative care options with a healthcare provider to prioritize comfort and quality of life. Sign 2. Increased fatigue or weakness. The second sign that an elderly person may be in their final year is persistent exhaustion or weakness that goes beyond the normal tiredness of aging. This level of fatigue can signal that the body is slowing down significantly. As we age, energy levels naturally decline, but in the final year of life, the body's energy reserves and organ function often diminish more rapidly. Vital systems, like the heart, lungs, or kidneys, may work less efficiently, reducing the oxygen and nutrients delivered to muscles and tissues. This can result in extreme tiredness, difficulty performing daily tasks, or a sense of heaviness that doesn't improve with rest. Chronic conditions, such as heart failure or COPD, can exacerbate this, while metabolic changes may limit the body's ability to produce energy. A 2024 study in geriatric medicine found that 70% of seniors in their final year reported profound fatigue that interfered with daily activities, often described as feeling weighed down or drained. This isn't just feeling sleepy, it's a deep, persistent weakness that can change how a loved one moves through their day. Consider a scenario where a loved one, perhaps your father, used to enjoy short walks to the park, chatting with neighbors along the way. Lately, you've noticed he needs frequent rests after just a few steps, or he's spending more time in bed, even after a full night's sleep. Simple tasks, like getting dressed or holding a cup of coffee, seem to exhaust him, and he's quieter, as if saving energy for every word. This shift from his usual routine to constant fatigue could be a sign that his body is conserving resources as it nears the end of life. Tip: if you observe increased fatigue or weakness, work with a healthcare provider to assess potential causes, such as anemia, heart conditions, or side effects from medications like beta blockers or sedatives. Blood tests or a cardiac evaluation can pinpoint reversible issues, and adjusting medications may help. Consider occupational therapy, which can teach energy conservation techniques, like breaking tasks into smaller steps or using adaptive tools, to make daily life easier. If the fatigue persists, discuss palliative care with a doctor to focus on comfort and quality of life. Encourage gentle activities, like seated stretches, if possible, and create a restful environment with minimal stress to support your loved one's energy needs. Sign 3: Withdrawal from social activities. The third sign that an elderly person may be in their final year is a noticeable withdrawal from social interactions or hobbies. Losing interest in activities or relationships that once brought joy can indicate a deeper physical or emotional decline. Social engagement is a cornerstone of well-being, but in the final year of life, many seniors naturally pull back from these connections. This withdrawal can stem from physical factors, such as overwhelming fatigue or chronic pain, which make socializing feel exhausting or unappealing. Emotional factors, like depression or anxiety, may also play a role, as can cognitive changes that make conversations harder to follow. Some experts suggest that seniors may have an intuitive sense of their life's end, leading them to conserve energy for introspection or closer family ties rather than broader social activities. A 2024 study in the Journal of Palliative Care found that 65% of seniors in their final year showed reduced participation in social events, often preferring solitude or minimal interaction. While this shift can be a normal part of the end-of-life process, it's a subtle warning sign that families should notice to provide the right support. A common observation is that some seniors stop attending events they once cherished. Picture a grandmother who loved her weekly church services, where she'd sing hymns and catch up with friends. Over the past few months, she started declining invitations, saying she's too tired or just not up for it. Family gatherings, once filled with her laughter and stories, now see her sitting quietly or excusing herself early to rest. She may even stop engaging in hobbies, like knitting or gardening, preferring to spend hours alone in her room. This shift toward solitude, while subtle, can signal that her body or mind is slowing down as she nears the end of life. Tip: if you notice your loved one withdrawing, gently encourage small, low-pressure social engagements, like a 10-minute visit from a close friend or a short phone call with a grandchild. Keep these moments light and comforting, respecting their energy levels. At the same time, consult a doctor to screen for treatable causes like depression, which affects 1 in 5 seniors, or cognitive changes, such as early dementia. A geriatrician can assess whether medications, therapy, or simple interventions like hearing aids could help. If withdrawal persists, consider discussing palliative care to focus on emotional comfort. Above all, meet your loved one where they are. Sometimes, just sitting quietly together or listening to their favorite music can provide the connection they need without overwhelming them. Sign 4: Increased confusion or cognitive changes. The fourth sign that an elderly person may be in their final year is new or worsening confusion, memory loss, or disorientation. These cognitive changes can be a significant indicator of declining overall health. As the body nears the end of life, reduced function in vital organs, such as the heart, lungs, or kidneys, can limit oxygen and nutrient delivery to the brain, leading to cognitive shifts like confusion or forgetfulness. Conditions like advanced dementia or Alzheimer's may accelerate, causing more pronounced memory loss or disorientation. Other factors, such as low blood sugar, electrolyte imbalances, or reduced blood flow from cardiovascular issues, can also trigger these changes. In some cases, the brain's natural aging process, combined with the body's declining reserves, results in episodes of mental fog or difficulty processing information. A 2024 study in geriatric neurology reported that 55% of seniors in their final year exhibited new or worsening cognitive symptoms, often mistaken for just aging by families. These changes are a critical sign, as they can affect safety and quality of life, signaling the need for closer attention and care. Families often report their loved one showing troubling cognitive shifts. For example, imagine a grandfather who always prided himself on remembering everyone's birthdays. Recently, he's been forgetting the names of his grandchildren or repeating the same question within minutes. He might get lost in familiar places, like wandering in his own neighborhood, or seem disoriented about the time of day, asking about breakfast at midnight. These moments, especially if they're new or worsening, aren't just quirks. They could indicate that his body and brain are struggling to keep up, a common trend in the final year of life. Tip: if you notice increased confusion or cognitive changes, seek a geriatric assessment promptly to identify reversible causes. Conditions like urinary tract infections, dehydration, or medication side effects, e.g., from sedatives or painkillers, can mimic or worsen confusion and are often treatable. A doctor may order blood tests, imaging, or cognitive screenings to pinpoint the issue. In the meantime, create a safe, structured environment to reduce stress and risk, use clear labels for rooms, keep a consistent daily routine, and remove hazards like loose rugs. If cognitive decline persists, discuss palliative or hospice care with a healthcare provider to prioritize comfort and safety. Supporting your loved one with patience and a calm setting can help them feel secure, even as their cognition changes. Sign 5: frequent illness or slow recovery. The fifth sign that an elderly person may be in their final year is frequent illnesses or a prolonged recovery from minor health issues. Recurring infections or slow healing can indicate a significantly weakened immune system, a common marker of declining health. In the final year of life, the body's immune system often becomes less effective due to reduced organ function and lower energy reserves. White blood cells, which fight infections, may not respond as robustly, making seniors more susceptible to illnesses like pneumonia, urinary tract infections, or even common colds. Additionally, the body's ability to repair itself slows, meaning minor issues, such as a small cut or a mild virus, can linger or escalate into serious complications. Chronic conditions, like diabetes or heart disease, further strain the immune system, while malnutrition or dehydration can exacerbate vulnerability. A 2024 study in the Journal of Palliative Medicine found that 60% of seniors in their final year experienced recurrent infections or required multiple hospitalizations, often with recoveries that were incomplete or unusually drawn out. These patterns signal that the body is struggling to maintain its defenses, a critical warning for families to notice. Consider a scenario where a loved one, perhaps your mother, catches a cold that lingers for weeks, turning into a stubborn cough that just won't quit. Or maybe she suffers a minor fall, scraping her knee, but instead of healing quickly, the wound festers, and she's bedridden for weeks, facing major setbacks. These aren't isolated incidents. Her frequent bouts of illness, like repeated urinary infections or a flu that lands her in the hospital, become red flags. I've seen cases like this, where families realize their loved one's body no longer bounces back the way it once did, marking a shift toward the final year. Tip: if your loved one is facing frequent illnesses or slow recovery, consult a doctor to explore underlying causes and discuss care options. Ensure vaccinations, like flu, pneumonia, and COVID-19 shots, are up to date to prevent avoidable infections. Address nutrition and hydration with easy-to-digest, nutrient-rich foods to support immune function. If infections or setbacks persist, talk to a healthcare provider about palliative care or hospice, which prioritize comfort and quality of life over aggressive treatments. These services can provide pain management, home support, and emotional care, helping your loved one stay as comfortable as possible. By staying proactive, you can reduce suffering and focus on meaningful time together. Let's recap the 5 subtle signs that an elderly person may be in their final year: significant weight loss or appetite decline, increased fatigue or weakness, withdrawal from social activities, new or worsening confusion, and frequent illnesses or slow recovery. Recognizing these signs early isn't about fear, it's about empowering you to act with love and intention. By noticing these changes, you can improve your loved one's quality of life, ensuring they feel supported and cherished in this sacred time. Seeing these signs is a chance to make every moment count. It opens the door to meaningful conversations, shared memories, and access to compassionate care, like hospice, that prioritizes comfort and dignity. You're not powerless. Understanding these signs lets you surround your loved one with love, create lasting connections, and find peace in knowing you're there for them. You have the strength to make this chapter beautiful, and resources are available to guide you every step of the way. If this video helped you understand your loved one's needs, please subscribe for more senior care and health tips to support you on this journey. Share this video with family, friends, or caregivers who might benefit. Together, we can spread compassion and knowledge. And we'd love to hear from you. Drop a comment with your questions, stories, or insights to build a caring community. Your voice can inspire others. By understanding these signs, you can give your loved one the gift of comfort, love, and dignity in their final chapter. Cherish the time you have, hold them close, and know that your care makes all the difference. Here's to honoring their life with grace and warmth.